All right, so these are some things when you're recovering from prostate cancer surgery or robotic prostatectomy. These are some things to really pay attention to. One is you gotta rest. You gotta rest. Your body just went through what I call controlled trauma. It's just something that your body in general needs to heal from. And so resting not only your mind, but also your body. Important to do after surgery, just to let the body do what it does best, which is heal. Urethra still needs to heal up at the place where the sutures are placed and where that catheter is. That urethra still needs to heal. And again, rest becomes so important in allowing the body to do what it does. What it does best is heal. It's got a system for healing itself, essentially. So let the body do what it does best. So rest, but you can't sit around and do nothing. Really, the instructions will likely say that your doctor wants you to walk every day and move. And the reason you walk and move is because you want to prevent blood clots. You don't want blood clots forming in the veins of the legs, because then those blood clots can move, and when they move, they can get to the lungs and things like that. So it's important to walk every day and keep those muscles pumping that fluid and pumping that blood back up. This is incredibly important with any kind of pelvic surgery, but prostate surgery in particular, very important to walk daily just to keep the fluids moving and keep the blood flowing. Decrease bladder irritants. The more bladder irritants you consume, whether it's alcohol, caffeine, citrus, anything like that, any kind of bladder irritant, it's just going to cause the bladder to be put on spasm, and it's just going to cause discomfort. So just don't put yourself through that. You already have a catheter in place. Your bladder's already going to be irritated just because of the catheter. So inducing other things that can irritate the bladder is just something that most guys want to prevent that kind of stuff. So decrease bladder irritants. If your catheter gets stick, sometimes the catheter can stick to the lining of the urethra at the tip, and that can cause some pain. So just put some ointment on the tip of it, either antibiotic ointment, Neosporin, or Vaseline, something like that on the catheter. I would tell my patients, antibiotic ointment, really, because Vaseline sometimes can collect bacteria and stuff. And so I like antibiotic ointment on the catheter if you need it. Don't hyperextend the pelvis. There's an area where this urethra is healing. You don't want to straighten up and stretch this area that's trying to heal. So hyperextending the pelvis is not something you want to do. You don't want to lift. You don't want to bend down and lift straight up, because again, that's going to put pressure on that area. So you'll have instructions, lifting instructions, but you don't want to be lifting after prostate surgery until you're cleared by your doctor. It's very important. Hydration, just gentle hydration. You have a catheter, you want to keep the catheter draining. You may see a little blood in the urine. It's usually not that big of a deal. Just increase your fluids and it should clear up. Ice is your friend for the first 48 hours after surgery, especially for these lower abdominal incisions. Ice in those areas just to decrease inflammation and swelling of those incisions, and it can help with pain relief and things like that. So the first 48 hours, no doubt, just some gentle ice or cold compresses is very helpful. And then after that point, then you kind of want to add heating pad, things like that for other discomfort. Anytime one of my patients goes to the ER, I always want to know as the surgeon. So if you do end up going to the emergency room for any reason, and if that doctor comes in and says, hey, we're going to do this or this or this, or the nurse says we're going to do this or this or this, my next question would be, have you talked to the surgeon? Because he needs to know what's going on. He may not want them irrigating your catheter. He may not want them removing it or putting a tube in. You don't want to let anyone do anything early post-operative time period. You don't want anyone to do anything without talking to the surgeon. The surgeon will have specific instructions. If the catheter needs to be irrigated, he will walk them through that and tell them exactly how much fluid to use and things like that. So very important for the ER or whoever to communicate with your doctor, your surgeon, because he will want to know about any problems with your care, especially if it involves you being in the ER and things like that. Last thing, don't get constipated. Pain medicine, if you do take narcotic pain medicine, it can constipate you, and you don't want this. The rectum sits down there where all this surgical dissection takes place, and if you get constipated and put pressure on those areas, it's just going to cause some discomfort. It's going to make your pain worse, and so just try not to be constipated. Be slow with your diet after surgery. My patients, I would always tell them, just slow with your diet. Don't force a bunch of food. Just take it easy and go slow with your diet, because your bowels and getting constipated and things like that's a huge issue that you want to avoid, and just all of these things. There's so much that goes in, but there are things that you can do to help your healing process, and so much of it involves right here. Rest. Let the body do what it's created to do, which it has an amazing capacity to heal and restore itself and put things back together and things like that. And that's incredibly important as someone heals up from surgery and undergoes surgery and now healing. And so important to rest, guys. That's it. I'm Dr. William Stiles, board certified urologist, talking to you on urologyanswers.com, a place where you can get reliable answers to your urological questions.